up, everybody? Welcome to the Whiteboard Brief podcast. We have a special guest on the episode today, Dr. Linsay Roth from the Body Remedy over in Andover. Physical therapist. In-house, you have Allie, who's over there doing chiropractic and a lot of body work and stuff like that.
Yep.
But the first time that we met was a couple weeks ago. You came out to our Fitness Through Motherhood class and kind of hung out for the whole time.
Yep.
And then we got to talking a little bit after that, me, you, and Coach Haley, and our thoughts on everything just aligned so well. So it only made sense to come here and do a podcast. So what I want to start with is just tell everybody a little bit about yourself, who you are, what you do, what you like to do in your spare time outside of the office and physical therapy. And then we're going to dive into a whole bunch of stuff, pelvic floor and getting people moving and all that good stuff.
Sweet. Yeah. Thank you, obviously, for having me here. I think it was cool. Like you said, the first time we met, it was just like, boom, a connection. We can talk about all things fitness, and it seems like we're on the same page with things. So that's pretty sweet. But as far as my background goes, so I'm a doctor of physical therapy. I started kind of the same way that everyone else does, where you go out, you're eager to get going, and then you very quickly realize that it's a very messed up situation that you're getting yourself into. So I started in the outpatient world and was seeing multiple patients an hour, not giving the care that I thought I should be giving, and just had this realization, like within my first couple months of being a physical therapist, that I want to do something different than this. Like this is not what I thought my career would be. So piece by piece, I was adding in different things. I started getting some like experience as a trainer. So I was trained through Mike Boyle's functional strength and conditioning coaching. So was doing that for a bit, was working at an F45, and then moved on from there to some other gyms. And with that was also working as a coach at the collegiate level. So I was an assistant coach for a college field hockey team, now a high school field hockey team, and then I assistant coach at Riviera University for their lacrosse team. So everything was always very like sports oriented, active fitness. But I'm like, how do I mesh all this stuff together to be a physical therapist? Because what I was doing was not what I really wanted to be doing. And that's kind of where my path led to Dr. Allie, who's the owner of the Body Remedy. We connected at a dry needling course, actually. So we connected there and instantly just kind of hit it off. She was in the cash-based world as a chiropractor, and we just decided, like, hey, I'm ready to take the next steps and make PT into what I want it to be. And she was ready to, like, move on to hire somebody. So we kind of connected, and that's where I landed where I am now.
That's so awesome. Now, from the PT's perspective, it's like, what did you want it to be? Because I know the PT world can look so many different ways. And from my perspective as a coach, and I'm sure that, you deal with it on a daily basis, it's like, what PT is right for somebody, what's not right for somebody, that gap that bridges people to get back to activity. And I know that you were very much movement based. You love movement, and that's kind of where we had that connection.
Right.
So like, what was missing before that you're doing now that just kind of lights your fire as a PT?
Yeah, so initially where I wasn't able to really load people the way I wanted to. Definitely like chronic underloading, I think, goes across the board for physical therapy. I don't want to speak for everyone, but the majority is that way. You see people who come in and they have back pain with squatting 200 pounds, but the heaviest weight you have in your clinic is a 15-pound kettlebell, and it's like, this doesn't add up, right? So how am I supposed to see what's really going on with their movement patterns if there's not even a barbell or anything that mimics a barbell within the clinic? So that was the first thing that I was like, that doesn't really make sense to me. Another big factor was just the way that insurance dictates what you can do. So most people don't know this, but the way you bill through an insurance-based physical therapy clinic, and the same goes for occupational therapy, you are billed based on an 8-minute rule. So it's kind of confusing. It's not exactly 8 minutes. You get between 8 and 15 minutes to bill a unit. And that would be how we get reimbursed. So in order for a clinic to get reimbursed well, they need you billing a certain amount of units per patient, which then means each unit has to be followed by these 8 minutes of X, Y, and Z. So I could do 8 or 15 or 20 minutes of hands-on therapy for one code, and then I'd have to do 8 to 15 to 23 minutes of exercise, and then figure out a way to maybe get one more thing in there to check the boxes so that my clinic is getting paid what the insurance is going to pay. which is not the way at all that I wanted to be treating. So if I want to spend an hour with you and the whole hour is hands-on work early on when you're in a lot of pain, that's not happening in a traditional outpatient PT clinic because you're not hitting those 8-minute markers. So that was another big thing that I'm like, there just has to be a better way to do this than to follow the rules, basically.
That's crazy.
Yeah.
Like, especially coming from, I like to give people solutions. You like to give people solutions. And it's like, if you're in that setting and you're restricted by the 8-minute rule, quote unquote, but also the clinic that you're working for, chances are if they're using insurance, they're a chain, right? They're not a small, family-owned business or a local business, whatever it is. It could be, and it could be part of a chain, but they're trying to make their business money. And if their model is coming through the insurance and you just want to help people, but that model works completely against that, it's like, oh, there's such a clash. And then, I'm sure from a standpoint of doing what you love to do, like that has to rattle your brain pretty like a lot.
Yeah, it does. And it doesn't just stop with that rule, right? It comes down to how many visits are they approved? At what point is insurance deeming this not medically necessary? So like the average person, if they're coming in just because of back pain with a certain lift, insurance doesn't necessarily care about that. So if they're functioning, they're going to work, they're paying their bills, they're doing things, insurance is like, sweet, they're fine. And then that's where it kind of ends, versus being able to actually get into a place where they're not just out of pain, because pain's not the indicator that things are going well. It's part of it, but it's not the whole picture. So if I get you out of pain, I want to then be able to address the things that first got you in pain and then build up your tissue tolerance. And that definitely doesn't happen in the insurance world either.
Yeah. And okay, this question is going to be loaded because I already know the answer. It's like someone comes to you for back pain. What's the timeline that they get their back pain better?
Not 3 visits a week for 4 weeks or whatever insurance wants to dictate.
It's different for everybody. And it's like if somebody comes into the gym and they're like, I have these goals for myself, well, there's so many different circumstances that dictate how long it's going to take for them to see that.
Right.
And that's really where we, try to put the message out there that, this is a long journey. This is something that's lifelong where, you're going to build these skills. You're going to do these different things so that you're on the right path to get there.
Yeah.
And I have to imagine that PT done the right way is very much similar where it's like, okay, let's get you out of pain. Let's find the root of that pain. And then, if it's strengthening certain areas, that could take a pretty decent amount of time. Right. So it's like everybody's plan looks a little bit different. And going back when you're restricted by all that stuff, it's like, how can you really help people get back to where they want to be?
Yeah, and exactly kind of how you laid it out is how I treat patients. So my first thing is let's get your pain down, right? So if you can't even roll out of bed right now because you're in that much pain, then let's address that first. Or it could just be pain with a certain movement, overhead, work, things like that. Let's get your pain down. That's step number 1. Step number 2 is let's get you back into moving and doing the things that you want to do. And then step number 3, once we're past that, is let's really build things up for you. Let's prevent this from happening again. Let's see how the small pieces all connect, and think much bigger picture there. So I do kind of follow a 3-step process where 1, get your symptoms down, get you feeling pretty good. 2, get you moving. And 3, let's get you on the right track for life versus PT, plan of care, 6 months go by, another PT plan of care, 6 months go by, same thing again.
Yeah, and I think it's like what I see too, especially someone coming from PT into the gym, and I think we talked about this the last time, is they'll go and do that process of the 8-minute windows and whatever it might be, and it's a lot of stretching, it's a lot of lightweight stuff, like you said, maybe the most is a 15-pound kettlebell or something that's in the office, right? Well, then you come in to the gym and you want to get back to your normal routine, or you're looking to strengthen yourself in a new routine, and you come into a CrossFit gym and you're going to learn to lift some weights, right? It's going to be very functional, how it's going to apply to you outside of the 4 walls of the gym. Well, how do you go from lifting something that's 15 pounds to something that's 50, 60, 70, 80, 100 plus pounds, right?
Right.
And, if someone kind of looks at me funny that way, it's like, well, if you have kids, they're going to continually get heavier, right? If you're picking up anything in the yard, I guarantee you it's 50 pounds or above. And then just from a standpoint of like having to be functional whenever you need to use it, like you should be able to lift more than 100 pounds safely and be confident in that.
Right.
And I just think that there's such a gray area in that traditional style of PT where, somebody will do the prerequisite stuff, get them feeling better. But then, like you said, where you come in, where I feel like a lot of other places don't, is what was the root of the problem and how do we bridge that gap to getting you functional again so that you're capable outside into real life or something like that.
Yeah, and I think that's why the model that I use really works, because people that I treat are active, right? They want an active solution. They're active people. They are exercising already themselves. I see CrossFitters. I see, people at different box gyms. I see F45ers, all sorts of athletic population. And they likely, if they've been injured, they've gone to PT because they want to feel better. And then they're like, well, this shit doesn't work. And then that also sparks the bad name for physical therapy, right? But it's that option of what do we do next when the first option didn't work? I'd love for everything to switch at some point where it's like, what do we do first that is going to work versus me being that backup option after failed surgeries, after failed attempts of PT. It's not quite there yet, but I think that more and more places are popping up that have the same idea.
Yeah. How much do you think it's affected by people's interpretation of the quick fix, mostly with a lot of other things that are in life? And then they come to PT to resolve a problem. Maybe the first route that we go down, or the first route that you go down, isn't 100% going to solve that problem. Then you start to pivot, because that's something that I do a lot with people's fitness journeys, where it's like, hey, we get started and we start to see things moving in the right direction, but either maybe they're not satisfied or they could be better. Or I start to notice, a change in their routine or their schedule that's going to start to bring things the other way or not get them the results that they wanted to see. And there's a lot of little pivoting, people's lives change.
There is.
We have to adapt to that. How does that relate to PT, where it's like someone comes to you with an issue, you start to resolve these issues, but either maybe something else pops up or there's something, another treatment that's going to work a little bit better. I think people misunderstand the fact that it's going to be different and it's going to change a little bit.
Yeah, and I think one of the biggest things I do to combat that, because I experience it probably the same way that you do, but just being so upfront in the beginning where your process with me is not going to be linear. There's going to be times where you take 3 steps back and then we hopefully take 4 forward. It's not going to be this perfect trajectory of healing, and that is the expectation right away. I think setting that immediately of saying hey, this is what recovery is going to look like. This is what rehab is going to look like for you. There's going to be setbacks and there's going to be times that we pivot, but being very upfront. And it also helps me from the standpoint of if somebody comes in 2 weeks later and they're like, oh, things aren't feeling as good as they were last week. I can reflect back to, well, the first day we met, we had this conversation and I knew this would happen at some point. So let's readdress it and see what else is going on.
Yeah. And what's your theory on people experiencing pain through the PT process? Because that's also a part of it too. If you're rehabbing anything, it's going to get sore. It's going to not feel zero pain all the time. But it's, in my experience, it's always been a little bit a part of the process of getting something stronger and getting it to a point where, no, I don't need to feel pain anymore. But that process, there is a little bit of pain in there, or soreness, or whatever it might be.
Yeah, I like to think of it kind of as a graph. So as your function comes up, that's going to start to spike pretty slowly initially. You're going to start to notice you're doing a little bit more. You're rolling out of bed now without back pain. You're getting up from the toilet without back pain. You're picking things up off the floor. So function's starting to creep up, but your pain's probably still there. So you're not noticing that you're doing more because you still have pain, but that's still progress. If you're doing things that you weren't doing before, right, you're progressing. And then at some point that graph switches and now pain is really coming down and function is really spiking up. So they kind of go, they creep a little bit in the beginning and then they take off towards midway. But I think showing people that pain is not going to be, like I said, linear. It's not going to be you have it and then suddenly you don't have it. It's going to show up and it's going to show up at different times. But let's see, what is that threshold? If at one point it was literally bending over to spit out your toothpaste and now you're back to deadlifting but you have pain, that's a big win, and that's progress, and we're going in the right direction. So like anything, it takes more time than we want it to, and me, you, anyone in this industry, we're not going to cut down the time per se. We're just going to get them there as effectively as we can.
Absolutely. And this is why I like having these resources, because it's you can do your thing. If I have somebody that comes to me in the gym that's feeling some sort of knee pain, and then I can refer them to somebody of such a similar mindset to how we do things in the gym, and then they can start to correct that. But we can also open up those communication lines as they get back to training, Where, like you just said, when they start to question that fact of like, oh man, my knee still hurts, but it's like, yeah, but you just back squatted for the first time in like 6 months. Like, that's a win. And then we can go back and forth and continue on that journey for that person. In my opinion, like, that's bridging that gap that I had mentioned earlier.
Right.
Where, the benefit of these two things is keeping people healthy and feeling good for a very long time. Because, if we can keep people moving and training and doing those things, man, their life is going to be great going forward, like well into the future.
Right. Yeah. I'm big on root cause, and I think root cause gets thrown out there, that term, in PT all the time. And it's like, let's get down to the root cause. But even some of the people that I see who thought they were at the root cause, they weren't quite there yet. And that's what keeps them in pain for a long time.
And just elaborate on that, because in my experience, and I think a lot of people that will listen to this episode or watch it or whatever, they don't necessarily understand that if they have knee pain, that could be a result or a root somewhere totally different. And it's like, everybody always wants to be like, my knees. And it's like, I know for me, for years, I had knee pain because my ankles had terrible mobility in it. And then you start to compensate and you start to add other things to the picture. So it's like, anybody that's active that ends up listening to this episode, like, what is your message on that? If they have pain somewhere, like, where could that root be coming from?
Yeah, so the number one thing that I look at now compared to when I first started treating is the spine. So I'm very heavily spine related. If you have shoulder pain, especially something that's between the neck and the shoulder, that's likely coming from the neck. There's not much in this area except your upper trap, which again is controlled by the nerves of your spine. So I'm always looking at the spine, testing things, ruling it in or ruling it out to find a true root cause. But then at that same time, I'm looking at the joints above and below. So say it is an elbow, I'm definitely looking at the shoulder, I'm definitely looking at the wrist, and I'm 1,000% looking at the spine. And that can be with or without neck pain, right? So you can have issues that come from nerves that come out of the spine, right? Your spinal nerves that can give you symptoms all the way down the arm, all the way down the legs if it's a low back type of thing. And I think a lot of people miss that. And they say, I'm looking at the root cause, but they're not looking back to the spine. Because if you don't have back pain, you can still have knee pain that's coming from the nerves of the spine. And I don't think there's a ton of clinicians that think the same way or have the training that I do that are able to reflect back and see, are these things connected?
That's super interesting, because where my mind went with that is we live in a population that predominantly sits all day, right, and doesn't get up and move around. So it immediately made my brain go, how many of these issues could be related to the spine from that one instance where people aren't up and moving around with good posture and making sure that they're taking care of themselves.
Right.
Because, like, I know, for example, number one thing that I hear if someone new coming into the gym is, I don't want to hurt my back. And then it's a process. Like, I don't say, wow, you're wrong. Like, your back is muscle too. But in reality, your back is muscle too. And, like, the muscle around that does protect your spine and the mobility of your spine. And it's so interesting that you say that, because, like, I could see how a lot of these issues could come traditionally from the spine just by where our society is and how much sitting around we do and how much lack of care that we do to our general core to make sure that it stays strong.
Right. And I think something that most people don't know or realize, or especially the lay person who's not in the world that we're in, that all your muscles are supplied by a nerve, right? So that nerve is the outlet that you're plugging into the muscle to give it its strength. So if you have this atrophy or weakness in a muscle, especially the rotator cuff, we see that all the time, your muscle is not able to function at 100% if the nerve is not giving it 100% of that input or that electricity. So yes, you may have some atrophy, some weakness in the rotator cuff, but is that just because the rotator cuff isn't doing its job, or is it because the nerve has some irritation and it can't supply the muscle enough? So I think that's one of the biggest pieces that's missed, and that makes my practice very different than others, because I take a very neurological standpoint and I want to look at what is the nerve health and how is that doing, so that we can then address what the muscle is doing.
That is so freaking interesting. And I have never been really aware of that prior to, but it's such like a unique way to approach it, but it makes so much sense. And like, I think that there's a big lack of the neurological aspect in a
Huge.
lot of the things that it's just in this space, right?
Mm-hmm.
And, you know, I'll use it in a slightly different way where neurological could be balance and coordination for somebody that comes in here. And they simply think fitness is cardio and lifting weights. And I was like, I had my 60 plus class standing on one foot the other day, like
Right.
for 10 or 15 seconds. And I was like, no, that's neurological. Or like moving your body in a certain way where your legs are doing most of the work and then your arms start to work or whatever it might be. Like that's neurological. But I never thought of it from that perspective of the nerve is what supplies the electrical contraction to the muscle. So if that muscle
Right.
is underperforming, people might just think it's weak, but it's like, no, go back to that stem of the power that it's being fed. It's like, what is not getting that thing to fire
Right.
properly?
Especially like if someone who works out and they, you know, they go here, they go anywhere, they're active, their muscles should be getting stronger, right?
Yeah.
Of course, our body's going to find the easiest way to do something, so there are compensations and things. But if you're isolating a muscle and it's not getting any stronger and the pain is not going away, it's probably not the muscle. It's probably what's giving the muscle the input, and that's just like hugely missed, I think.
That's crazy. Wow. That's amazing. Yeah, my mind is absolutely blown. That is so awesome. Now, quick pivot, but I want to stay on the same topic because I'm curious how that would relate to pelvic floor health, since that's something that we just started here. You know, that's how we really met when you came in for that fitness through motherhood class.
Yeah.
Does that apply in the same aspect? Do you approach it differently?
Yeah, so it's very similar. So as a pelvic floor physical therapist, my main background is ortho and orthopedic conditions, right? Your typical pains everywhere. But pelvic floor needs to be looked at as an orthopedic condition. It's muscles, it's nerves, it's ligaments, it's tendons, it's all that same stuff. It's just in the bottom of our pelvis versus in my arm or my shoulder or my back or whatever. So I take a very, very orthopedic approach to pelvic health. And again, looking at, are these nerves irritated? Your nerves, especially your sacral nerves, those are supplying input to the genitals, different things like that. And if those nerves are irritated, well, we're not really going to fix that root problem elsewhere, especially in the pelvic floor. So I'm definitely looking at nerve health there. I'm screening the whole spine. And just from a full standpoint, like pelvic floor physical therapy is not just Kegels and pelvic floor. It is this whole system of things, what's going on above it. That relationship between the diaphragm and the pelvic floor is essential to treating pelvic floor therapy and different conditions, but also the hips. So if you took an actual pelvic model and you looked down in it and you saw all the different names of the muscles there, you could then look at a flat chart of the muscles of the body and see these same names of the muscles in the glutes, and you're going to see, if you rip the glutes off, what's below that. Some of these deep hip rotators and hip stabilizers, those same muscles are the ones that you're looking down into, like looking at the bottom of the pelvic floor. So you can address that stuff the same way you address any other muscles of the body. They're just muscles. They play such a crucial role in the hips, like the hips and the pelvic floor relationship. They're essentially the same thing. If your hips aren't moving well, then your pelvic floor is not moving well. So you can look at it from a very similar lens of it not being this very intimate process. It doesn't have to be so scary of it being pelvic floor. It's just muscles, it's nerves. They're all doing the same things. It's just a different part of the body.
Yeah, I think it's nice that it's starting to become more common conversation now, because, for the most of it, I would have even moms that have been moms for a very long time. And it doesn't even have to be moms. Like pelvic floor health goes well beyond just that. But like the certain symptoms that they might experience felt like they were the only one experiencing it. So like this, common knowledge or this conversation that we're starting to have around these things and making it more common so that if something does arise, they can go seek it out, or prior to anything even arising, like just understanding what happens when somebody gives birth and then you start to come back to activity. Like when I started to learn about that, it blew my mind that I believe it's 4 different bones that create the pelvis, and they just literally separate themselves and expand during pregnancy and childbirth, and then they start to come back in. So to your point of like all those deep muscles that we wouldn't normally, get to or attack or see superficially right on the outside of the body, like all of that stuff is starting to move around and it changes and strengthening it back up after that.
Right.
Like, that blew my mind. There's so many things going on there that, it just makes sense to start to do this thing the right way. I my mind gets blown when I started to learn way more about that. What are some of the common things that you see of somebody coming to you about pelvic floor health? Like, what's your typical client coming to you to see?
So I see, because it's an active population, I see people that have leakage with jumping, box jumps, jump roping, double unders, squatting. So more of the leakage side of things. But then I see a lot of people who are more on the pain side. So they might have PCOS, endometriosis, years and years of constipation, which can really be treated through pelvic floor therapy. Not alone, but it's a big portion of it. Pelvic pain, pain with intercourse, tailbone pain, deep hip pains, all of these things that are related orthopedically, they're just in a different area.
Yeah.
So a lot of that pelvic organ prolapse is something I'll treat, especially if it's somebody who's active who feels their pelvic heaviness or symptoms with certain activities. Birth prep, someone who has chronic hemorrhoids, someone who is pregnant or postpartum. There's delivery prep. There's a ton of different things.
Yeah.
But a lot of what I'm treating is actually coming from pelvic tightness and a lot of tension versus something being weak. So I think that's a big misconception as well, is that everything about pelvic floor is let's get this stronger and stronger. But what we need to do first is see, can it lengthen? Can it relax? Can we reduce the tension? Because that could be causing the problem. And in my experience, most of the time is causing the problem.
Wow. Yeah, as we went through Fitness Through Motherhood, as you know, there's like a big education piece to it. And like everything that you just said, most of the time outside of just the leakage portion of it, like when we started to bring up these different topics and I would send the moms all these emails, and then they started to see all these other aspects that go into pelvic floor health, started to open up their eyes and their minds to everything that was like collectively going into it, even to the point of like, why is one leg unstable, like single-legged movements or unilateral movements? Why are they unstable after childbirth when you can squat pretty normally and under balance? So like, opening up these conversations and getting it out there. And I think a lot of that is still not on the table and common knowledge to most people. Like I can see the incontinence thing starting to come out, especially with CrossFitters that do box jumps and double unders and, super heavy lifts and stuff like that. But everything else that starts to go into it, like where do you see the next level of this so that people are getting this education, and what can they start to do about it?
I think it's hard to answer because I'm so far in it that my whole world and my algorithm and my social media, everything is
that
pelvic floor, fitness, PT, all that stuff. But really, it's a crappy answer. But doing your own research, if you have a symptom that's going on, try to find someone who is a specialist in that symptom, and someone who is doing what you want to be doing. So there are plenty of pelvic physical therapists out there. Well, I don't want to say plenty, but there's more and more now.
Yeah.
But me going to one who's more of let's get on the table, let's do like they're doing manual release internally and things like that might not be the right approach for me, who is someone who might be having symptoms that's coming on with activity. So finding the person that's doing things that you also want to be doing. If it's an active person, go to an active physical therapist. But I guess researching and just trying to find the places and making the connections. I know. I don't have a great answer for that one.
I honestly think it's just doing this right now. Because like the more people that can hear these different things, it's just going to spread the word to be like, someone mentioned something that they might be feeling, and somebody listened to this podcast and they're like, oh, no, wait, like this is something that you can probably correct or potentially correct. Like you should look more into that. So I've always found that talking about it and making it less, awkward to talk about, or making people feel like less they're the only ones dealing with it, just benefits like unbelievably. And I've seen it with just so many people in the gym as well, just in the last 4 years.
Even having like a program like that you have here is huge, because you think of like CrossFit as this big, mighty, it could be like a scary thing for people, but you can take a population that might feel a little bit more vulnerable, or they're a little bit more nervous, or they're hesitant, or they're not quite ready, and get them doing these things, and also get them talking about this. So other CrossFit gyms can see like what's going on here, and like, oh, that's something that we should be doing. So even just your programming and having the motherhood course is huge for showing people that that is an option too.
Yeah.
So definitely like getting the word out as much as you can, but as the consumer or someone looking for it, I think you just have to keep looking and not accept no, or not accept I don't know.
Yeah.
Just keep asking and keep looking until you find the right connections or the people that can get you to the right connections.
Yeah, and I think that goes back to like there's no perfect solution to anything like that, because like we said before, like you could be treating somebody and you could go a totally different route after you learn a little bit more about them. It's the same thing when you're trying to find somebody as this resource or this second opinion or whatever it might be. It's like, make sure that you match with the person, make sure that that relationship feels good, and if it doesn't, don't be afraid to pivot and seek out somebody else, because like you said, there are a lot of people coming into this space, and the way that you handle things is much different than other people might.
Right.
So, that those resources are out there and they're becoming more prevalent. So I think just talking about it more in the Fitness Through Motherhood, and also having that contact sheet that I give all those moms too, to be like, hey, here are your resources in the local area, and I know every one of them personally,
Right.
like to the point where we've done podcasts together. So it's like I feel comfortable sending them to go talk to you, and it's like, okay, your way, they're going to help, or they're going to get the help that they're looking for, and if they can't, maybe there's another resource, whatever it might be.
Yeah. So to your point, I actually like found the pelvic floor world through my own experience. So I have endometriosis. I had a big surgery for it 4 or 5 years ago, and for years and years and years had a ton of pelvic pain. And it took me 4 different pelvic floor therapists to find the one that I felt good about, to find someone who I jived with, who kind of like shared the same interests and beliefs, and like they could see my goals. And it took me that amount of people to find someone that I was comfortable with. And this is my world, right? Like I know physical therapists, I know the companies around us.
Yeah.
So it is hard to find, but there's different options out there. And my approach might not be something that everyone's comfortable with, but there is someone else who will have the approach that you need too.
Yeah, that's amazing that you do have that story, and I think it speaks volumes to the way that you probably help people, is having that experience on your own and understanding what that person in front of you could potentially be feeling. And I know we talked about this when you were in the gym before, but all of us collectively working together, as a whole, is what's going to make this population more healthy into the future.
Right.
Because there's a lot of people that need to be helped. And like I said, if like 1% just came into our gym or our office, we'd be overwhelmed. So, the more people that we can start to get this message out to, the more people that can get on board to working together to make this world a healthier place, it's only better.
Yeah. I mean, I couldn't agree more. It's much less of a competition than it is let's find the right fit for me, because that's going to be the right fit for you as well. There's plenty of people to go around. We just got to get to them.
I love it. So where can people find you?
So in the Body Remedy is in Andover, Mass, but online I go by Doc Roth. So you can find Instagram, Doc Roth. I have a Facebook page, and then the Body Remedy MA itself has its own website, and all of that info. And then I work at Lift, which is a gym, like a strength and conditioning gym. So I'm there a couple days a week for classes as well.
Awesome. And I love the fact that you have a squat rack in your office. Yeah. And everybody that's local that listens to this, the Whole Foods in Andover, her office is right there. It's literally right
it's a 2
across
for
the
1.
street. Yeah, it's perfect. You can go get something to eat and then go right in there. This has been awesome. Is there anything else that you want to leave people with, a message or anything? I
would just say keep trying and try again if it doesn't work the first time, because those people are out there that are really passionate about helping you. You're one of them, right? People rave about how you treat people here, and I want to have that same reputation, but keep finding the people that you really can connect with, because there are plenty out there who really dedicate their hours to it.
Yeah, that's amazing. Together, I say this all the time, we're going to have people gray hair and wrinkly skin still lifting some awesome weights and doing some pretty cool stuff when they get older, and I think that's the way forward, and it starts with people like you.
Thank you.
Awesome. All right, this has been a pleasure. Everybody, I hope you enjoyed. If you ever need any information or anything like that, feel free to reach out and we will get you in contact. Let us know how you like the episode, and we'll see you on the next one.
Thank you.